on 32nd episode of Phatak Materia Medica live series. We will discuss or decode the another remedy from the Phatak, which is very important in the day-to-day practice, is Antimonium Crudum. So in Phatak, the choice of this remedy is determined by mainly by mental sphere and gastric sphere. So Dr. Phatak says that the patient is crude mentally and physically. Dr. Phatak says this patient is crude mentally and physically. What does it means? Crude means undigested, unrefined, undigested, unrefined, gross, heavy, thick. This is the gastric remedy at its core. The patient is a gross feeder, a glutton, eats beyond the digestive capacity, eats without discrimination. And because of that, the mental symptoms, skin symptoms, and joint symptoms all secondary to gastrointestinal disturbances. This is why the Antimonium Crudum is so powerful day-to-day's OPD remedy. So let us understand the inner theme of Antimonium Crudum is overloaded, oversensitivity, irritated simplicity. This patient is simple-minded but easily offended. He does not analyze deeply. He reacts. If you look at the child needing Antimonium Crudum, he cries if touched, he cries if washed, he cries if looked at. So the patient may say that the philosophy behind this, don't disturb me. This is the life philosophy of Antimonium Crudum. Now understand something deeper. This is patient becomes sentimental in moonlight, romantic, dreamy, lovesick. If you talk to them during daytime, they are cross, irritable, angry at small attention. There is contradiction. Crude stomach, sensitive emotion. In modern life, eats junk food, has a chronic acidity, has a warts, has eczema, gets irritated easily. This is the Antimonium Crudum. In mental level, patient may say anxiety about fate. Patient may say that doctor, what will happen to me. This is anxiety about destiny. Sometimes even inclination to shoot himself, but not dramatic like Aurum, more sulky and withdrawn. So cries if looked at. In the children, cries if looked at. Mother says that doctor, he doesn't allow me to even touch to him. This is the key. Children who cry if washed, cry if bath, touched and examined. Aggravation from cold bathing. Love sick girls, young girls with disappointment in love, suppressed menses, ovarian pain. She becomes dreamy, talks in poetry and silent. Antimonium Crudum covers ill effects of disappointment in love, suppressed erection and suppressed menses. So in disappointment, it is very close to the natrum mur and ignitia. Loathing of life, food and bathing, but paradoxically desire for acids and pickles. Nervous excitability start at slightest noise, twitching in the muscles, restlessness, sleepy, weary, drowsy. Contradiction is very characteristic as in ignitia. Physical generals. Now we come to the day-to-day essential things that thermal stress, thermal symptoms, aggravation from heat of summer, sun, radiated heat, warm room, especially for the cough, moonlight. Better in open air, rest, moist, warm. So, aggravation from cold bathing. In appetite and digestion, gross feeder, gluten, overeating, stomach always overloaded, vomiting after eating, belching, tasting of food, belching, tasting of food, food repeats. Child vomits milks in curds after nursing. This is the classic symptom of Antimonium Crudum. Tongue, a very important clue to the entry point for prescribing the Antimonium Crudum. So, thick white coating as if whitewashed. This is the keynote. If you see white coated tongue, gastric disturbances, irritability, you may think of Antimonium Crudum. Thirst, often no thirst, but desire for acids, pickles, aggravation from sugar, sweet, vinegar, pork, sleep, sleepy, weary, drowsy old people, deep unrefreshed sleep. So, particular symptoms in head symptoms, headache after cold bathing, headache from gastric disturbances, aggravation from sweet candy, acid fruits, aggravation ascending the stairs, heaviness in the forehead with vertigo and nausea, nosebleed after headache. So, in day-to-day clinical practice, this type of headaches is associated with hypertension with gastric disturbances. You may think of hypertensive headache in the Antimonium Crudum. Also, headache after suppressed coryza, eyes raw, cracked canthi, chronic blepharitis, pustules on the lids margin, photophobia, chronic sore eyes in the children. And strange symptom is looking into fire leads to cough. Remedies, this is particular modality. Nostrils cracked, scabby, eczema of the nostril, nosebleed after headache, cold sensation on inhalation. Cracked are very characteristic in the Antimonium Crudum, as is in the canthi, in the nostrils and corners of the mouth. So, in the mouth symptoms, tongue coated thick white as if whitewashed. If this present with gastric disturbances, you may confirm the Antimonium Crudum prescription. Other symptoms of the are bitter taste, salty salivation, gums build easily, aphthe, toothache before menses, toothache aggravation touching with tongue, better walking in the open air. In stomach symptom, the core of the Antimonium Crudum is stomach overloaded, vomiting after eating, no relief after vomiting, irritation of the tasting of the food, sweetish water brush, bloating after eating, pork disagrees, desire for acids and pickles. Child vomits milk in curds after nursing and refuses to further nursing. So, here is the differentiation that athuja from athusia. Athusia wants to nurse again immediately after vomiting. The key symptom is athusia wants to nurse again immediately vomiting after vomiting. So, you may differentiate with these two remedies. In abdomen and rectum, diarrhea alternating with constipation in elderly people, summer diarrhea, stool mixed watery with lumps, mucus stool, mucus piles with yellow staining discharges, hemorrhages with solid stool. Lumpy characteristic appears again, stool, leukorrhea, skin, nails. So, in many of my patients with severe constipation and piles, I will give one dose of if the patient is not responding to the routine remedies. The intercurrent with severe constipated patient with piles or with pressure, I will use Antimonium Crudum 10 dose in as an intercurrent in many of the cases, and it gives a very good result. Especially in the stools are lumpy. Female spears, menses suppressed from cold bathing, nymphomania from checked menses, ovarian pain in lovesick girls, leukorrhea watery with lumps, nausea vomiting during pregnancy. In respiratory symptoms, cough aggravation entering warm room, cough from looking into the fire, first attack severe, subsequent weakers, burning in the chest, expectoration, large quantity of mucus like lumps and exhaust the patient. So, opposite of many remedies here is the warm room aggravation. In extremities and in skin, a very good remedy for horny warts, thick split nails, growth under nails, callosities of the soles like in corns, feet tender, arthritic pain finger, rheumatoid arthritic tendency, eczema with gastric derangement and itching aggravation in the bed. So, skin eruption suppressed lead to chronic complaints. Suppressed eruption lead to internal gastric or joint trouble. This is the classical picture. In modern day-to-day practice, it will be anti-crude be useful in chronic gastritis, functional dyspepsia, GRD-like symptom, IBS with alternating constipation and diarrhea, chronic blepharitis, eczema with food aggravation, warts, corns, fungal infection of the nails, rheumatoid arthritis, rheumatoid deformities of the finger, gout shifting to the stomach. So, well, so some remedies which are very related to the antimcrude are Noxomica. Noxomica is ambitious, competitive, angry and businessman in mind level. Antimcrude is sulky, childish, doesn't want to disturbances. In physical level, Noxomica is chilly, desire for stimulant. Antimcrude has aggravation from sun heat, aggravation from cold bathing. So Nux is sharp, antimcrude is crude. So another remedy is pulsatilla. Pulsatilla which weeps, seeks consolation. Antimcrude cries if looked at, rejects attention. In physical level, pulsatilla has no thirst, desire for fatty foods. Antimcrude has desire for acid, pickles and aggravation from porks. Another remedy is sulfur. Sulfur is philosophical, egoistic, while antimcrude is simple, sulky. In physical level, sulfur has burning heat, red orifices. Antimcrude has thick white coated tongue, cracks and warts. Sulfur fierily intellectual, antimcrude is crude and gastric. So when we think that thick white coated tongue, gastric overloaded indigestion, cries if touched or looked at, desire for acids, wart, thick nails and cracks, aggravation from cold breathing. So in day to day's OPD level, which type of patient we need to look at when or we should think of antimcrude for prescription. So think when there is gastric disturbance, indigestion after overeating, stomach feels overloaded, erection, tasting of food, vomiting after eating, with thick white coated tongue. No thin coating, no yellow coating, thick white coated tongue. In mental level, in children's, cries when touched, silky and silent adult, angry at small attention. So, and then confirm by desire for acids and pickles, aggravation, warts or thickness, cracked at the corners of the mouth, aggravation from cold bathing and aggravation from heat. So, combine this and then prescribe antimcrude. So, complementary remedies to the antimcrude is sulfur. Both have skin and gastric link, but sulfur is hot, fiery, intellectual. Antimcrude is crude, sulky, white tongue. So, often after giving antimcrude, you may think of giving sulfur. Also, in milk vomiting, we may compare the Athuja synapium. Athuja wants milk again, and antimcrude repeats this milk after vomiting. So, Dr. Phatak mentioned one of the remedies, Sila, complementary to the antimcrude in respiratory sphere, where the cough and mucus predominate. So, suppressed eruption, chronic gastric disturbances, thick white coated tongue, think of antimcrude. Another comparative is the calcarea cup. Both have fat, slow digestion, thick skin, warts. But observe carefully, calcarea is fearful, anxious about health, insecure, sweaty head in the children. While antimcrude is irritable, cries if touched, sulky, no deep insecurity. In gastric level, Calcarea craves egg, milk intolerance, sometimes low digestion but not necessary glutons. Antim crude is gluton, it's beyond the capacity, strong desire for acids and fecal. So calcarea have fears, antim crude have reacts. Another remedy is graphitis. Both have thick skin, cracks, eczema, but graphitis is sticky discharges, oozing honey-like fluid, constipation with large stool. Antim crude has then again lumpy theme, watery mixed stool with lumps, thick white coated tongue, gastric center is more prominent. So graphitis is sticky, antim crude is again crude. Another very closely related remedy is thuja. Both have warts, but thuja has fixed ideas, feels fragile or strange, chilly, oily skin, antim-crude has sulky, gastric disturbances, white coated tongue, aggravation from heat of the sun. If if digestion is overloaded, think of antimonium. In miasmatic understanding of antim crude have all three miasms. Sora is base, gastric disturbances with hypersensitivity. Psychotics is warts, thick nails, callosities, and syphilitic tendency with crack and destructive changes, dry gangrene. So this is a mixed miasmatic remedy. All three miasms. So it is a deep acting remedy. It has suppression patterns. Chronic complaints traceable to the suppression of the eruptions or ulcers. So skin eczema treated externally after 2 to 3 years, gastric symptoms, then later joint pains and gout. This is the classical pictures of antim crude. In also you may in the rheumatoid arthritis you may have a rheumatoid tendency with this background: arthritic finger pain, thick nails, gastric disturbances, history of suppressed eruptions. In anasarca or marasmus, this is not first line remedy, but we have to distinguish with white coated tongue, gastric weakness, sleepiness, and alternating stools. So in acute and chronic stages, in which acute symptoms, which acute stages or which acute have a good result in antim crude as overeating at wedding, think of antim crude, summer diarrhea, acute indigestion, child vomiting like curds, sudden aggravation from cold bathing. And in this type of picture, we may check thick white coated tongue, gastric overloaded, irritable mood, aggravation from sun. Then the acute prescription is justified with antim crude. In chronic constitutional use, there may be many conditions with recurrent eczema since childhood, thick toenails, warts repeatedly appearing, alternate constipation and diarrhea, IBS, rheumatoid arthritis tendency or rheumatic tendency, sulky personality since years, suppressed skin eruption history. Then we are not treating the only gastritis, we have to treat the whole constitution. So in that whole picture, we may think of crudeness like of anti-crude, think of suppression, hyperkeratosis and gastric weakness. So acute antimcrudium is stomach episode and chronic antimcrude has whole personality pattern. So antimcrude patient may show skin thickening tendency, slow metabolic processing, recurrence every week or few weeks, hypersensitive to minor attention, strange absence of pain where pain is expected, bed sores without significant pain. This is the key. So in acute summer diarrhea, some key point of the children very commonly used remedy: diarrhea in summer, watery stool with mixed with lump, irritable child, cries when touch, white coated tongue. A very practical pediatric drug. Few doses of 30 potency will give result. Acute aggravation after cold bathing in some children with we may give the symptoms of coryza, headache, gastric upset, menstrual suppression. So this is characteristic. Cold bathing aggravates the symptoms. So let us understand some key to the pediatric prescription. How antimicrobe a child look like, or how we can understand, or how we can recognize the antimicrobe. So fat or tendency to go fat in children, irritable, child cries if looked at, doesn't want to examine, throws things when disturbed, summer diarrhea tendency, vomiting, vomits milk in curds, thick white coated tongue. So in pediatric we may differentiate from athusia, as I already told you, that milk intolerance, collapse tendency, wants milk again after vomiting, and antimicrobe refuses further feeding after vomiting. So another key is that after vomiting, in athusia has great collapse or prostration, and he wants again to feed, where antimicrobe refuses to feed. Like chamomilla is extremely angry, wants to be carried, one cheek hot, one cheek red. Antimicrobe does not want attention, sulky, not screaming in range. So chamomilla demands attention, antimicrobe refuses the attention. In old elderly people, mostly prescribed remedy, and how to recognize these old people in day to day's practice. So drowsy, sleepy, alternate in constipation with diarrhea, thick toenails, callosities, arthritic finger joint, stomach always overloaded, history of some suppressed eruption in the youth. Patient may appear slow, heavy, thick-skinned physically and emotionally. So this may be the elderly constitution. In fever, is a characteristic fever remedy in children and some. So we have to observe carefully for while prescribing antimicrobe in fever. So great heat from little exercise, heat of sun aggravates, heat and thirst after sweat, gastric disturbances during apyrexia in intermittent fever, fever with white coated tongue, digestive complaints prominent, irritable sulky mood. So strong postation and rattling of chest, think of antimonium group. In respiratory, cough aggravation in entering warm room, cough looking into the fire causes cough, burning in the chest, large quantity of mucus, exhausted after expectoration. So antimicrobe aggravation from heat of the stomach and warm room. So compare with antimtart. Antimtart has rattling in the chest, extreme weakness, cold, pale collapse and cyanotic tendency. Antimicrobe has thick white coated tongue, gastric center, warts and thick skin, not necessary have a extreme prostration. So antimtart has respiratory collapse, antimicrobe has gastric overload. In skin cases, antimicrobe is a good remedy for urticaria, a good remedy for psoriasis. In many conditions, antimicrobe has great result. So while urticaria, we may prescribe antimicrobe and with great results. White eruptions with red areolae, itching, aggravation of the warmth of the bed, eczema after overeating. So a characteristic symptoms while in urticaria. So think of white coated tongue, then stomach symptoms, overloaded stomach, and then itching in the bed. So this is a classical picture of urticaria of antimicrobe, and a few doses will recover. Also one key that Dr. Phatak is not mentioned, but I have observed in the repertory, urticaria after meat or urticaria after non-veg, a few doses of antimicrobe helps great in this type of patient. So quick revision of the antimicrobe is thick whitey coated tongue, gastric overloaded, irritable and sulky, aggravation from sun of the heat, aggravation from cold bathing, lumpy theme, characteristic. Lumpy theme is warts, lumpy, stool lumpy, nails lumpy, thick, separates the eruption history. Then some strain uncommon symptoms of the antimicrobe. So, absence of pain when it's expected, peculiarly in the bed sore. There is big bed sore, but patient don't have pain. So, ulcer is painful, bed sores are more than that of painful, but antimicrobe has less or minimal pain as compared to lesion. So why this is this is have no pain? Opium has different painlessness and antimicrobe has different painlessness. This is due to dull reactivity, blunted inflammatory response. So this is a rare but uncommon symptoms, confirmatory sign in bedridden patient. Sentimental in moonlight, another key. So this is a beautiful and subtle, romantic, dreamy, emotional under soft light. But in daytime, irritable, sulky, avoids attention. So in contrast with pulsatilla seeks comfort. Antimicrobe wants isolation. Another key, that a person who talks in rhymes and verbs. Very rare symptoms, mild poetic tendency. Very few people who talks in rhymes and verse. But not intellectual philosopher like Sulphur, more dreamy, more childish one. Another uncommon symptoms of antimicrobe is so busy with oneself, forgot the urinate or defecate. This is shown that the inward absorption, indifference from depression, more self absorbed or dullness. So patient is so busy that he in self or doing his work, so forgot to go to the urinal or defecation. Troubles from swimming or falling into the water. A very good remedy in summer diarrhea or summer complaints. And this is another key elements from for the antimicrobe. Aggravation for cold immersion or cold bathing. This can trigger cough, cold coryza, menstrual separation, and gastric upset. Cold bathing aggravates in not minor but is structural. Then another great key often ignored in the antimicrobe is periodicity and recurrence pattern. So symptom recur after every 5, 6 or 12 weeks. They may change locality. This is extremely important. Eczema flares every 2 months. Joint pain shift from right to left. Gastric upset if after 6 weeks. So this is periodicity or recurrence. Then as we discussed, miasm is mixed miasm, not single miasm is prominent. Antimicrobe in modern days, how to identify the antimicrobe in modern days as children addicted to junk food, adults with chronic acidity and thick nails, elderly with slow metabolism and arthritic deformity. So metabolism is sluggish, digestion is overloaded, and skin have thickness. So it represent the improper processing for the both food and emotional level. So while thinking this, eat excessively, digestion is weak, skin thick, cracks appear, becomes irritable, want to be left alone, and symptoms recurrent periodically. This is why what is the antimicrobe. And in integrated picture and visualization of the antimicrobe is slightly overweighted child or person, summer heat, thick white coated tongue, refuses to examine, warts on the hand, loose motions after every part food. This is antimicrobe. In elderly, drowsy, alternating the stools like constipation and diarrhea, thick toenails, has a history of suppressed eruption, sulky nature, again think of Antimonium Crudum. So, uh, white coated tongue, overeating, sulky child, warts, aggravation from heat, this is Antimonium Crudum. So, remembering Antimonium Crudum and prescribing some checklist we must need. So look at the tongue, is it thick, white coated, then keep in mind Antimonium Crudum. While specific examination, a white tongue, we must have a think of antimonium group, and then it is thick, more towards the antimonium group. Then after that, ask the digestion. If the overloaded after eating, food repeats, vomiting after meal, desire for acid pickles, aggravation from sweet, then another confirmation. Obese personality, child is irritable if touched or examined, adult is sulky, doesn't want to talk, angry with small attention. And in physical level, look at warts, thick toenails, thick skin, callosities on the callosities or corns on the food. These are the confirmatory to the Antimonium Crudum prescription. So, prescribing Antimonium Crudum is not on the single symptom; it is a pattern of the symptom. So, gastric centered constitutional remedy, glutton, overeat beyond the digestion, tongue thick white coated, irritable, sulky, cries if touched, aggravation from heat of the sun, aggravation from cold bathing, desire for acid spores and that disagrees, lumpy theme, stool, warts, nail, sputum is lumpy, and suppression of eruption leads to internal diseases, periodic recurrence, shifting complaints, thin skin outside, sensitive emotion inside. Potencies of the Antimonium Crudum, very wide range of potencies of Antimonium Crudum that I use. I use it from the 6C, 30, 200, 1M, 10M, 50M, CM, all potency and 50 millisievert scale also very useful depending upon the case, depending upon the sensitivity. Few examples I have already told. I have good results of Antimonium Crudum with urticaria in 6 potency, in lumpy stools with piles with not giving results to the by another remedies. I give 1 or 2 doses of Antimonium Crudum 10M or 50M or CM, and other indication and relation lead to prescribing. In thick skin condition, warts and callosities or corns, 200 potency is the good. In psoriasis with thick and cracked skin, 30 is good. So depends upon the situation, patient sensitivity and susceptibility, potency varies. So as a patient or as a Antimonium Crudum personality who eats excessively, digestion poor, react irritably, avoids attention, develops thick skin lesion, complaints recurrence periodically, and often has a suppression history. There is no dramatic, no intellectual, no hysterical person. This is simply overloaded, and where overloaded long enough, pathology begins. So, in simple word, Antimonium Crudum is overloaded, oversensitive, and thickened. This is all about Antimonium Crudum, a very long remedy, very deep acting and very useful remedy in the day-to-day practice. So, thank you for patience listening. Now, we will see in the next episode. Thank you very much.